You don't say much these days, but I still hear you in the space between the words we've lost. Love whispers at what cost? The flame is dim, but flickers still. A little at what cost? The flame is dim, but flickers still. A little at what cost?
Good evening, good afternoon, good morning. How are you today? It is an amazing, amazing day we have here, and we are just 1 minute. All right, so my name is Grace Nzula, and we are really, really honored to have you tonight, and we are very, very excited to be with you this evening as we end the month of May, which is also a mental health month. I think we have been doing quite a number of things for the last couple of years around mental wellness. And we thought that this one we should not also be left behind. So, good evening, people. How are you? How are you? You can let me know on the chat. How are you? And where are you joining us from? Let me know on the chat. How are you and where are you joining us from? I am just quickly going to introduce what we do. My name is Grace Nzula. I'm a HR consultant with Atara Solutions. Atara Solutions is a HR consulting and training company. We offer 4 services. We have HR manager outsourced for those organizations that don't have a full-time HR manager or that require support in HR. We also do offer what we call HR consultancy. Are you looking to revamp your policies? Are you looking to do job evaluations and job analysis? Are you looking to do salary surveys? That is part of what we do. We also offer recruitment and selection as well. So you are tuned into what we call Get It Right with Atara Solutions. Get It Right with Atara Solutions is a webinar series that seeks to demystify issues in employment and entrepreneurship. I was just thinking right now, we are actually on season 7. We started this in June 2020, and look at us now in 2025, still going strong. We actually clock 5 years on 23rd of June. And I remember back then when we used to have mental health sessions and we'd get 600 people. But I guess the world has become better and we are getting better at managing ourselves, that we are not getting the 600 people we used to get back then. Nonetheless, we are happy to have you. And it is really, really an honor to be with you. Before I give a shout out to our partners, allow me to just see who is on the chat. We have Phyllis from Darakanidhi. Hi, Phyllis. Phyllis Koech from Darakanidhi. Really? Are you the tipping vote? And then we have Laura from, she is blessed. We have Eda from Laikipia. And how are you, Eda? How are you doing? And then we have Kule from, he didn't say from where. And then we have Nantobeko. What way? Nonto from Eswatini. Please say hi to my good friend Sharon from Eswatini. Yes. And then we have Manish from Kampala. And we have Nancy. Good evening. You are happy to be here. Thank you very much. Jacqueline from Ethics and Integrity Institute. And then we have Laura from Kampala. Simon Frank from Tanzania. And we have Brita Kule from Uganda. Oh yeah, Kule, you're from Uganda. Excellent. We have Namu from Eldoret, Rachel from Nairobi, Amina from Mombasa, Terry from Nairobi, Jovius from Tanzania. Thank you so much for joining us. That is the entire East Africa. Where are the Rwandans today? You're not joining us? Or yeah, probably not. I don't know. I hope to listen to you soon. Hi, Alice. I'll call you right after this. I've just remembered I saw your missed call. I will call you right after this. Please do not worry about that. So at this point in time, allow me to give a shout out to our partners just quickly so that we can also get into the conversation of the day. All right, so we have Nile Front Cottages. Nile Front Cottages are cottages located in Jinja, Uganda. If you're looking for a bikecation, solocation, whatever vacation you want to take, then you need to visit Nile Front Cottages. We have Profiles International. Profiles International, if you're looking to become a Genius Emotional Intelligence Certified Coach, or you're looking to do psychometric assessments, then they offer those services. We have K Square, K2 HR Services. K2 HR Services are our partners located in Kigali, Rwanda. If you're looking for HR services across East Africa or in Kigali, Rwanda, then K2 HR Services will be able to support you on that. We have Steadfast Quality Solutions. Steadfast Quality Solutions is an organization, our partners located in Kampala. Steadfast Quality Solutions is headed by my good friend Herbert Zake. Herbert Zake is also a Gallup Strengths certified coach, and Herbert Zake has coached over 500 executives. So if you're looking for a coach, then you need to get in touch with Herbert Zake. However, if you're looking for someone to do your board evaluation, conduct board trainings, and help you in recruiting board members, then Steadfast Quality Solutions offer those services. We have AAR Insurance. If you're looking for WIBA, if you're looking for vehicle insurance, all your insurance needs, then AAR. We have Hotel Sapphire. Hotel Sapphire is a hotel located here in Mombasa. Yes, Catherine and I are in Mombasa today. And Hotel Sapphire is located right in the middle of town. And they have amazing conference facilities. And they have food as well. And they have an amazing band on Friday. So if you're around Mombasa, you need to visit Hotel Sapphire. And then we have Tufaha Resort. Tufaha Resort is where we went for our this year's road trip. It was such an amazing, it is such an amazing place, very exclusive. You need to go to Tufaha if you're down in Nanyuki. It is such a beautiful place. You need to check them out online and just get to visit them and get to experience the warm swimming pool, just FYI. And then we have Panessa Training Institute. If you're looking to study woodworking, if you're looking to understand how to work with wood, then Panessa Training Institute, they are running their May intake as we speak. And then we have Port Sacco for all your Sacco needs. And then we have Sotet Kinyumbani. Sotet Kinyumbani is a restaurant located as well in Nanyuki. If you're looking for African food, if you're just passing through Nanyuki, you need to pop into Sotet Kinyumbani and get to enjoy an African meal there. And then we want to welcome you to the Growth Grid Mentorship Program. If you're a HR practitioner who is transitioned to management roles, then this is for you. And we are starting on the 2nd of July. We are at the cost of only 24,000 shillings. The classes are 8, which takes place every Wednesday from 8 p.m. to 9:30 p.m. from 7:30 p.m. to 9:30 p.m. If you're in Uganda, it is 680 1,402 Uganda shillings. And please join us. We've just graduated cohort 1. Now we are going to cohort 2. And we had, yes, Simon Frank from Tanzania was also part of that cohort. And we have representation from Kenya and Uganda as well. And then allow me to invite you to the African Transformation Leadership Conference. This is going to be happening on 6th to 8th of August in Nairobi. And now, African Transformation Leadership Conference is a signature program that happens across Africa, and they move to from different African nations where they actually go and hold conversations on how to just get better at leadership and matters affecting Africa as well. So I want to welcome you on 6th to 8th August in Nairobi, and we will share details as we go along. So, of course, did I introduce myself? Yes, Grace Nzula from Atara Solutions. If any of you is here in Mombasa for the IHRM conference, please say hello. And of course, I am here with my co-host, Catherine Sidandi, our sign language interpreter. In fact, today we actually learned how to say, I appreciate my work, or your work, sorry. I appreciate your work. Yes. And my whatever, I caught that one. Yes. Yes, that one, totally, absolutely there. So thank you very much, Catherine, for making us inclusive. I think my co-host will join us later, Mr. Richard Magoma. He's not there yet, but he will be joining us, I'm sure, shortly. So tonight we're having a conversation on productivity and how mental health actually impacts how we perform. And with us tonight, we have Rosemary Gadara, who is the executive director at Basic Needs, Basic Rights. And of course, we have Dr. Chitai, who is a consultant psychologist and currently working at what do we call it? KU, Kenyatta University. So I'll give you a minute to probably just do an intro just quickly, and then we can go on to the conversation tonight. And maybe we can start with you, Chitai, and then Rosemary can introduce her. Oh, wait, no, Rosemary, Chitai, and then we come back to you, Rosemary.
Yes, good morning, good afternoon, good evening from I heard we have people joining us from different parts of the world, and it's lovely to be able to speak with you today. My name is Rosemary Gadara. I'm the executive director at Basic Needs, Basic Rights Kenya, and looking forward to have this conversation about how well-being inspires well-doing.
Thank you for that, Rosemary. Dr. Chitai?
Yeah, thank you, Grace, and the Atara Solutions family. My name is Dr. Boniface Chitai. I'm a consultant psychiatrist, not psychologist, although I understand the confusion. I think 1 or 2 years ago, I wrote an article about 10 differences between a psychiatrist and a psychologist to educate the public, because it's a common question and a lot of confusion. And also professions within mental health. I try to break that down. So I'm a consultant psychiatrist, currently a lecturer at Kenyatta University School of Medicine. I'm happy to be here.
Excellent. Thank you for that. And maybe you need to share with us that article. I think we need to dig deeper into it, because sometimes when you're talking about psychiatry and when you're talking about psychology, yeah, we get lost in the terms, and a lot of people actually, probably a lot of people get stigmatized because they hear they're going to a psychologist, and then the only thing that comes to their mind is medication. And then they don't get the actual difference. But yes, here we are today, and you probably will take a few minutes to, maybe you should now. What is the difference between psychiatry and psychologist, Dr. Chitai?
Okay, so just briefly speaking, first, they are both mental health professionals, but their background is different, and what they do is slightly different as well, although there are also similarities. So starting with a psychiatrist, so psychiatrists train as medical doctors, and then out of the many branches of medicine, they specialize in psychiatry, which I can say it is medicine plus psychology. So medicine plus psychology more or less gives you psychiatry, you know. And so if you visit a psychiatrist, their technique will be more or less like that of a general doctor. They will take a history, examine you, send you for some lab tests to find out whether your symptoms are due to something else, or that is not, mental illness or so on. But it's malaria that is making you feel depressed, you know. that's what psychiatrists do. And so they work with, so a psychiatrist will generally make a diagnosis and then make a plan of management, investigate and then make a plan of management. Then more or less they will involve a psychologist, because they work together. Psychologists study behavior of human beings and how it can be modified to make human beings more healthy, either in whatever direction, whether the human being we're talking about is starting from a position of just being okay, but they want to improve their psychological well-being, they can see a psychologist and they can be assisted, all the way to issues like counseling, where it's about solving one particular problem. And then now where clinical psychologists take part in administering specific therapies like cognitive behavior therapy in major depressive disorder. That's the commonest example, so I'll give that one. But generally, one should know that even for psychologists, there are also different cadres within psychology. Yeah. But Rosemary is a psychologist, so she might want to add something. I don't know. So, but basically, in short, that's the difference. If you want to read more, you can check some of my write-ups on social media at Dr. Chitai. You'll find that post even on my X.
All right. Did you need to add anything, Rosemary, as you also start us off on how well-being inspires well-doing?
Thank you very much, Grace. And yeah, maybe just to clarify, no, I'm not a psychologist. I'm actually a nutritionist by training. That's my field in health. However, I have managed community mental health programs for quite a number of years, and so my experience comes from managing community mental health programs and what I have learned from the professionals and the community and lived experience champions that I have interacted with. So I'll just start by saying what I'm referring to when I reference well-being. So we're all on the same page. And it's basically about being well, whether it's physical wellness, but of course our focus right now is on emotional well-being, mental well-being, having a sense of purpose and meaning, a direction, and generally being able to cope, having good mental health, being able to cope with the daily stresses of life. And I'd like to mention that this is such a huge factor when it comes to productivity. At the workplace, I'll mention we run a huge program in schools. Basic Needs, Basic Rights Kenya runs a mental health and resilience program in schools, public schools across the country. And we run it for the learners, but we realize that the teachers benefit a lot from it. There are times when we do the teacher training for the teachers to pass on the skills to the learners, and the teachers say, pause, let's first talk as if you're talking to us. So I'll give some of the examples we encounter. We work with junior school. In Kenya, we've had a curriculum change, and so we have junior schools. These are adolescents. And we know the emotional changes that happen for adolescents as they're transitioning through into teenage and onwards. And these are 12 to 15-year-olds, usually in grade 7. And so when we're talking to the teachers and helping them pass on these skills for resilience to the learners, sometimes you have the teachers who will say, I got maybe at 80%. But I was employed as a math teacher, and I teach really well when I teach math. However, I've been assigned to teach physics in the class in junior school. It's not a strong point for me. So the well-being that was going so well at 80 dips. New technology is introduced in the workplace. You're now a new team, or you have a new supervisor, or changes in your organization, and well-being sometimes dips. Now, we've had people who give up. We've had teachers who return to the TSC. I was employed as a physics teacher, and I'm off. Of course, that brings challenges. I mean, so other issues. I'll let my colleagues struggle. I'll not faff around. Let's see if the children learn the fast. And half the time, that person is aiming for other jobs. They're not really being productive, but they're making the most. Coming to work isn't really productive. But we have people who in the observe who thrive.
You're breaking factor. Quite a lot.
When somebody can bounce back inner strength, as well as oh dear. Oh,
you can
you hear me now? Off. I'm really sorry today.
Yeah, you can try video.
The internet.
And then she's gone. All right, let's go to Daktari. Daktari, maybe as we wait for Rosemary, who was laying the background, you can also tell us, how does well-being impact productivity? And maybe you can also share a few examples now, because you're a practitioner.
Yeah, so thank you very much for that question. Anybody who has come across mental illness can really appreciate how being well mentally affects productivity. And I appreciate that even as we talk about wellness, it's good to think about wellness in a holistic manner, where there is physical, mental, there is financial, and even social wellness. It's good to always think about that in general. However, if you come to mental, if you have ever experienced someone with a serious mental illness, you may almost decide that they may not be able to work in that state of illness. However, again, it's important to know that mental illness is not always in that severe form that we are used to. So it's not always someone who is dysfunctional, who is on the road, or someone maybe who is aggressive and so on. But that's the picture we are used to. So mental illness can also be very subtle, as for someone maybe suffering from mild depression, even to moderate depression, things like anxiety, things like social anxiety, where the person's problem is the fact that they are unable to, they feel uncomfortable when they meet new people, or when they just meet colleagues. They feel very uncomfortable about it. And that can be one of the reasons why this person is not coming to work. It could be issues around substance use that is affecting the person. And it can, for some people, it can be quite subtle. There can also be issues around personality disorder. So if you look at the aspect of mental illness, basically, if someone is suffering from some of these illnesses, what will be the outcome on the individual? One is that they may not come to work consistently because of the aspects of the illness. They may also have challenges with being less productive at their workplace. So they come to work, but maybe they would have given, whatever percentage of work they would have done, it's reduced. So they are present. It's called presentism. They are present, but they're delivering less than they should. We also have the issue of the person leaving the workplace. So if you have someone whom you've been working with, who is experienced, you've trained them, and they leave, that's also a lost resource. Of course, when the study was done in Kenya, they also looked at death. That, if someone, that mental illness also causes loss to the working population, because persons with mental illness will live for fewer years than people without mental illnesses, and so that is how it affects. However, also studies have actually been done around this issue of productivity. One which found that one in 2010 by some very famous psychiatrist called Thorncroft and Brohan. So which found that if the mental health is improved at the workplace, then the workers' satisfaction with the work is increased, and so there's their own satisfaction, but also they are able to be more productive. So they are satisfied, but the company also does benefit from just them being well. So that is a study that was already done, and that's what it found. So so in that regard, then we can say, but also there's been the issue of, you said you wanted some example, and I can give the example of Aga Khan University Hospital locally, which put in place, which has in place a wellness program, and a study was done around that program, which established that the productivity of their workers went up by 66% because of having that wellness program in place. And that's a very good example. I'm sure there are many others. So thinking about this issue of productivity and mental health, it's also good to know where does the bad mental health come from. You know, why do employees experience poor mental health to begin with? So it could be factors to do with the employee themselves. It could also be factors to do with their colleagues or their seniors, colleagues at the same level or seniors within the company, or it could just be the nature of work. It could be some jobs are very stressful, and we can never say that stresses are all equal, and stresses are different. But there are jobs which, by their nature, they are extremely stressful. First responders, you know, if your job is doing firefighting or you are working in an ambulance, by the nature of that work, it is very stressful. But there are also jobs which are very demanding. You know, you have to deliver this by this week and the deadline is coming. So you find that the employees are always stressed. This can be some of the, you know, where this comes from, conflicts, you know, between the employees, in the relationships they have with each other, but also challenges that have to do with the bosses. It's important to know that when it comes to mental health challenges, anybody can suffer from mental health challenges. And because anybody can suffer from this, then even the bosses themselves can be affected. When someone behaves in a way that people cannot understand, you know, all these people call the very bad bosses or toxic bosses. If if we were to give them, if they were to undergo some evaluation, some of them could be found to maybe suffer from also some challenges. So it's important to know that if we start talking about mental health challenges at the workplace, we have to look at the employee, we have to look at the boss, you know, the manager, and we have to look at the nature of work that the person is doing. At least we look at it in that manner. And then now we can think about how to improve. But it must first start with agreeing that if you improve mental health, then productivity will go up. And then the last maybe statistics I can give as we start this discussion is that a study led by UNDP, Ministry of Health, WHO, done in 2021 about the case for investment in mental health in Kenya found that Kenya loses up to 62.2 billion shillings every year due to mental health challenges. Out of this 62.2 billion, only 5 billion, which is a very small fraction of the 62 billion, is due to healthcare expenditure treating the mental illnesses. But a whopping 56 billion, I don't know what percentage is that, but it could be over 80, of these losses that the economy suffers was due to lost productivity, mainly due to absenteeism and presenteeism. Yeah. So mainly due to absenteeism and presenteeism, all 56 billion. And what did they find? When they did a projection, they found that Kenya can actually save up to 161 billion in 10 years if we invest in prevention and promotion of good mental health. And that includes mental health at the workplace. Back to you, Grace.
Interesting statistics, and there's something off about your what do we call it? Sound. This it has something at the end. I don't know what, but that is quite interesting, and those statistics are quite something. In fact, I think I will be writing notes eventually as I review this recording, because that's quite interesting. And to hear that we are losing that I mean that those amounts of money based on absenteeism and presenteeism, it's quite interesting. But Dr. Chitai, just what are some of the common indicators of mental health struggles do we have in the workplaces, or maybe just we can notice with people that actually negatively affect performance? What are the telltale signs?
So so for one to suspect a mental illness, the one has to start with a change. What is the change in this person? Yeah, what were they that now they are not? Or what were they not that now they are? So change. What has changed? Even it can be that productivity that now they are no longer productive, they're not completing assignments. That can be the change. Yeah. But other things can include maybe picking up quarrels easily, isolating oneself, yeah, maybe becoming very aggressive, yeah. So it can be all this, or it can be issues. It can be around issues around suicide and so on, yeah, where the person shows suicidal behavior. These things happen at the workplace. Yeah, so when it comes to the signs, it will depend on the mental illness. So what I would prefer is for people to pick out the change. What has changed? Are they more? And by the way, some changes may look good at the face value, but it may end up making someone dysfunctional later. For instance, someone who suddenly becomes hyperactive, super talkative, and that's not their nature. They are super talkative, they are very active, they are picking up other people's assignment or work. It could also be a question of, even bipolar. The person maybe is going into a state of bipolar called mania. In that case, they may be hyperactive. So any change is important. And then, especially if it's sustained change. So this person is having these things over days to weeks, not just a one time, but over days to weeks, they are showing consistency of behavior, then that shows that there's probably something going wrong. And it's important. It's important for workplaces to actually have a way of screening or even self-screening available. I know we'll talk about solutions later, but even at this point, it's good for me to say that it's important for workplaces to have screening so that in cases where people suspect that this person has changed, then they can be offered screening to even screen themselves and see whether there's something that is going wrong. Back to you, Grace.
Yes, sorry, I was on mute. So okay, fine. So as we screen, I'm just wondering, sometimes we face resistance from leadership or even staff when it comes to mental health, and especially when we link it to productivity. How can what are some of the ways we can work towards dealing with the change resistance, and especially getting managers and leadership to actually support mental health initiatives? What are some of the things we can do?
Okay. So resistance also has a reason. It comes from a certain place. It can be resistance from management. And if it's coming from management, it may be because of the cost. And if management is resisting because of the cost, then whoever is championing this mental health at the workplace must make some effort to ensure that this makes business sense, And that was the whole reason why this case for mental investment study in Kenya was made, so that you can show some return on investment, if you address certain problems. For instance, it was seen that the return on investment for treating depression is 5. So for 1 shilling that you invest in treating someone with depression, you get 5 shillings back. For anxiety, it was seen to be around 4 bob. So if you invest 1 shilling, you get 4 shillings in return. And for alcohol use disorder, it's about 3 shillings that you get in return for investing 1 shilling. So it's good to you make a case. When people reject things, it's not that they know that those things are bad. Sometimes it's because they don't understand what it is. And that's the gap that advocacy must fill. So there must be some element of advocacy to make people understand why this is important. If resistance is coming from the staff, it could also be because of lack of education. It may be because they don't understand the importance. That may be one, but they could also be educated about mental health, but stigma can be a challenge. It can be the reason why they don't want to take the screening, and they don't want anything to do with discussing issues of mental health. So then that means that whatever program comes up, at least it will address all these possible barriers. So 1, Yeah, we should have consistent educational programs at the workplace. Yeah, consistent. We should have people championing mental health in that workplace. But still, we can go a step further. Yourself, Grace, you are a human resource professional, and the role of wellness has always fallen within human resource. And I stand to be corrected because you're a professional in that area. And in future, I think we may have to think about having a mental health officer, because you may be taking more than you can handle as HR professionals. So we should now talk about mental health officers. And we invest. If we understand it's important, we will not question. We are going to invest in mental health. And then we must understand that mental health is also affected by other issues that people are going through. So we talk about wellness in other areas, like physical wellness, yeah, like nutrition, you know, like financial wellness. And financial wellness can include educating, the workers, but maybe that's not enough. We must have policies that also take care of people's remuneration. And Grace, I think there's been this discussion about trade unions, trade unions. What could be the role of trade unions in this when it comes to issues around wellness? Is there a role that a trade union can play? Trade unions came because relations between employers and employees was always based on intimidation of the employees, and people not being able to raise their grievances. And when that happens, then you have issues of strikes. Before 1963, there were a lot of strikes in Kenya between workers who are working for the colonial government. And so when we got independence, some steps started to be made by the likes of Mboya, coming up with the Industrial Relations Charter that later became the Labor Relations Act. So there's this good history, and personally, I'm a former trade unionist, and I believe that trade unions can actually help employees, because before the doctors' union, for example, was formed, doctors used to just resign and go to other countries like Namibia. But after the KMPD was formed, what we saw is that there's an element of people staying. In fact, there has been a trend in the past where doctors want to move from private sector to government, which was the opposite previously. And perhaps it can even reduce, it can reduce the tensions that we see, and the number of strikes even. Yeah, so I think we must open up channels, because I don't see, how, for instance, an individual worker can advocate for themselves. They will be afraid, because it could be a question, they could be victimized, for instance. So, and even as we think about this, and I want to put this as a challenge, in the coming days, one problem we're going to encounter is employees claiming mental health injury or injury due to mental illness that arose from the workplace. There are no structures, I can tell you. There are no structures in Kenya where I can assess that this illness came because of the workplace. But it is coming. If there's something I can predict, is that it is coming. We'll have to see more and more employees coming forward and claiming that because of the conditions in this workplace, because my boss was calling me at night, because of this and that, they did not listen to me. Now I have this condition. How will we deal with it? And that one we have to discuss between ourselves and the HR practitioners.
That's very interesting, Chitai, because we had a mental health, a burnout session this afternoon here at the conference, and one of the things we were talking about is whether we have like a mental wellness day, a mental health day in the office, or whether we are ready to look at mental health from a point of occupation health and safety. And I think that is you're aligned, because I think that's a conversation that's actually brewing. I mean, two people on the same day cannot just be from nowhere. So I think it's brewing, and it's communication to us in management to actually figure out how it is. And Chitai, you're right. We are, some of us are dealing with mental wellness issues in the workplace, and we are really not taking time to educate ourselves and top up with whatever we know on matters mental health, so that we can become maybe even mental health first aiders. I think some of these courses, we need to take them seriously from a HR point of view, or from line managers. If you're a manager, I've seen Edward, who is a manager at one of the ranches in Laikipia. And from management point of view, I think this is a very important conversation, because you're on the first line. It's like emergency contact list. But allow me to take a question. If you have a question, you can put it on Q&A. Sophie, I'm not too sure I understand your question. How do you help a mental issue that is character related or consistent bad behavior in a person? Chitai, do you understand?
Yes, I sort of understand
Okay.
what she's talking about, and that falls under the category of mental disorders that are subtle. It could either be it's mild, but if she's mentioning character, that there's an issue with character or bad habits that are very consistent, then it can be a personality disorder. Yeah, it can be a personality disorder. And the point is, because personality disorders, by their nature, they are stable, and the individual most likely does not know that there's anything wrong with them. Some of them, by their nature, could also contribute to the person's success, in a way, as much as some people will be distressed. Yeah. So we could be talking about someone who is actually successful, but there are some challenges that are very consistent. That are very consistent with the individual. How do you deal with it? It is difficult. Personality disorders are very difficult to deal with. The person can only be helped by self-knowledge. So this is the kind of individual who needs to be educated enough to find a reason to even go to a psychologist for exploratory visit, to just explore, not necessarily for any treatment, to explore and then get it from that professional that there is some issue here, and the problem here is caused by this and this. Your parents separated when you are 2 years, or your brother used to beat you up. That is the origin. Yeah, both your parents used to work and they were busy, they were not there for you, and that's why you're behaving like this. So it has to be someone trying to explore the issues of this individual in a safe environment, for them to be able to come to a point of realization, because you will be dealing with someone who has no idea that anything is wrong with them. Yeah.
That's very true. So okay, this is interesting. So we don't have cure for personality disorders, do we? No.
Okay, so let's just say that difficult to treat, but they can be managed through psychotherapy. So for most of them, we don't give medication.
Interesting. Now see, about bringing professionals on this thing, you guys are demystifying. Chita, you must come back. I already have a topic for you.
Okay, thank you.
Yeah. There's Miriam who is saying, please comment about mental wellness to people who have been abducted or tortured, like the housemaids who work in Saudi, or some of the people in jail who were jailed innocently.
Okay, so that comes down to stress. So for most mental disorders, it is your genes are interacting with the environment, and stress is a component of the environment. So if you expose any human being to high levels of stress, they can end up suffering from a mental disorder. even if they are not really predisposed, because of the high levels of stress. So the stress that can tip you over depends on your predisposition. That's one. So, but high amounts of stress can make any human being develop a mental disorder like depression, post-traumatic stress disorder, and so on. So people who are jailed or people who have been in Saudi Arabia are at risk to the extent of the stress that they have suffered. And so I don't know if I need to say anything else, but also stress can also come because of losses. When you lose, you get stressed. So someone who is in jail has lost their freedom. And when you lose freedom, you get depressed. And you can get other issues also. But the first thing is that you could get depressed if you lose your freedom. And other losses, there are other losses. And I want to mention these other losses because sometimes, because when you talk about mental health, sometimes you think about mental diseases, but there are mental issues or conditions that are not necessarily diseases, and they're related to loss. So loss, start with freedom. If you go to jail, there's an issue there. Then other losses will be things like bereavement. So you lose a loved one, yeah, you become vulnerable to the extent of that stress. You don't have a mental illness, but you may feel as if you are someone who has depression. Yeah, if you lose your business, is another issue. Loss of marriage, and so on. So, in short, what I'm trying to say is that we should be very considerate of people who are going through losses at the workplace. That's very important, because I mean, you hear some workmates will tell you, oh, you've lost your dad, and someone tells you you're not the first one to lose your dad. Just come to work. Another one told me that your relative is already dead, so why don't you just come and work, when I was working at an emergency department. So you see, that's lack of empathy, and these are medics. So I can imagine what people go through when they go through loss. So I think it's important that people are given time off to recover from these losses, and they are supported in whatever way possible, so that they don't tip over. And even sickness, if you suffer from any other sickness that is not mentally related, it could still end up being a loss. You have lost your good health. So we have to be considerate and give them adequate accommodation.
Yeah. There are two questions on alcohol use disorder. Oh, okay. They're saying, what does AUD, alcohol use disorder, cause mental health disorders?
Okay, good question. So alcohol use disorder is itself a mental disorder. AUD, alcohol use disorder, is itself a mental disorder. So is the use of other substances like cannabis, miraa, and tobacco, and others, heroin, and so on. It's not the use that is the disorder. So using alcohol or using any of these drugs does not automatically translate into a disorder, but it is the pattern of use. So if someone is using the substance in a way that is harmful to them, and they have lost control of the substance, for example, they're trying to stop and they can't, or they are sick physically or mentally and they can't stop, yeah, or the amounts they're using are increasing, or they keep getting into trouble because of the use, then that can translate to a substance use disorder, which includes alcohol use disorder. And it's important to emphasize, because people did not consider substance use disorder to be mental disorder, and generally it's difficult to relate. It is because it is one disorder where people think that this person is participating in the habit themselves. And so empathy usually reduces for people, for example, who have alcohol use disorder at the workplace. but it's a mental illness. When you talk about mental illnesses, you talk about mental, neurological, and substance use disorders. So you put them together. Now, can use of alcohol, forget about the alcohol use disorder, just the use of alcohol lead to a mental disorder like depression, for example? And the answer is yes. So you can have somebody who is suffering from depression because they're using alcohol, and when they stop using alcohol, their depression resolves. So and different substances can cause different disorders. Even psychosis, which looks like schizophrenia, can be caused by any of these substances. So substances can cause mental disorders, and they will mostly be present when the person is using that substance.
Mm,
I hope I
yeah.
answered that adequately. Yeah.
I think you have, because there was also somebody else asking about you commenting on alcohol dependency. But we can move. There's a question from, is it Mary? Anyway, I'll come back. But she says she wants to know about ADHD and mental, emotional dysregulation, the symptoms. I don't think we can go through to that now. Maybe you can mention a few. But how does a staff deal with the kind of leaders that have either ADHD, emotional dysregulation, or bipolar?
Dysregulation or bipolar. Okay. So I think the question is, how do you deal with a manager, supervisor, or any other boss who has a mental disorder? Maybe you know, maybe they don't know, yeah, or they know you know, and but how do you deal with them? It's honestly difficult, yeah, because it's difficult if the person does not acknowledge the disorder, the person suffering, if they don't acknowledge. So, and they may deny it also because of stigma. And that's why it's important to fight stigma so that people readily accept and even prepare that maybe one day one may suffer from a mental illness. It's not, mental illnesses are common to the extent that there's no family, even those who are attending this webinar, which has no person with a mental illness.
Correct.
Because we're basically talking about 1 in 4 people. I don't think if there are many families, including extended, which have 3 or less. So it is so common, and it has to come from a point of acceptance, which comes from education of the community, and that can be the only remedy. However, again, if there's some sort of a policy at the workplace, this is what we've been talking about. The Ministry of Health came up with very good guidelines, but then they said that these guidelines can be used in public sector, private sector, informal, and so on. So if people can customize this policy or guidelines at their workplaces, then mental health issues can, workplaces can be more mental health friendly. So it can be easy to open up a conversation. If I go beyond here, I'll be advising, I'll go into advising, but let me advise. So if you are in such a situation specifically, I think it's good that you speak to someone who is equal to them to talk to them. If they are a manager in the organization, you can speak to another manager to talk to them if you've noticed something that you suspect could be. So they are more likely to they are more likely to listen to someone who is their equal with no consequences. Back to you, Grace.
Yes, 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 yes. And it just now maybe we can move to solutions. How best would you incorporate mental wellness into a young organization culture? What are some of the programs that we can incorporate into young SMEs, maybe, so to speak?
Yeah, so I think we've spoken about most of them, and those that have been tried and tested includes improving the policy, which would include also improving awareness at the workplace, which will lead to decreased stigma. That is simple, it can be done. But what we should avoid is having one talk in a year and then pretending that now we've taken care of our mental health issues at the workplace. I also think we should not just tokenize. I'm speaking as a professional in mental health. A lot of times you are invited to help organizations and they treat the whole thing as if it was a second thought, that we did not think about this, but it's like someone mentioned it at the end, 2 days, they give you a call. So I think there should be planning and investment. If we truly believe that it's important, then we must invest. The programs, whatever you want to do, should be holistic, because we know that mental health is affected by many other challenges. So there can be an element of stress management, financial literacy, physical activity. There's this Google that we use, the company itself. They even they have a gym at the workplace. They have some dance classes. They have nutritional expertise if you want. You see, these things are provided. I know Google is big, but at least let us do something that is holistic, physical activity, and so on. And then there is these whole things we talk about adapting some form of hybrid system of work. Yeah. Some people say work from home, others say work from anywhere, but I think it is also something to think about, to give some people flexibility about work. It is seen that people do better with that. And then we integrate the mental health into the organizational culture. So where there is some friendliness, two things affect people, employees with mental, and this may not even require any money, but if someone is unwell, giving them time off to seek help, to go for their appointments, to maybe get admitted, maybe go for rehabilitation, giving them time off, you are helping them. And then when they come back, now that's when things go wrong. So now, if this person has a small quarrel with someone, asema huyo ni mtu wa madhare. You see, once you have such an environment, then you will not go very far. So welcoming back people who have been unwell, after they have recovered and now they're okay. Even if they relapse later, it's okay. They can relapse later. Some don't relapse also. So not everybody relapses back to illness. We should not have a mentality that once someone has a mental illness, they'll always have it. No, you can recover completely and never suffer any other episode. So it's good to understand. And it's not that they'll not be productive. They're going to be productive. But it's good we also make sure that we make sure that we understand them. They may require some accommodation. Let me give you a good example. And I live from hospital again because that's my area. If I have a nurse who has suffered from depression, I will not put them on night shift. Night shift is more stressful. So put them day. And sometimes they request and we refuse. So give them it's called reasonable accommodation for someone with mental illness. You don't need a letter from a doctor to convince you that this person who has been unwell should not work at night. Do something about it. Back to you, Grace. I think those are the few that can be done. Yeah.
I agree, and probably maybe I can add, having conversations. There is always something happening every month around mental health, and I think it's a conversation we need to normalize, so that when you hear somebody has depression, you don't go preaching to everybody, and it doesn't come like a shame. Sometimes when you hear, oh yeah, they're on sick leave. Yes, what is it? What is wrong? Oh, they have typhoid. Oh, they have malaria. No one is raising eyebrows. But when you hear they are on medication, or rather anxiety medication, or they have been admitted because they have depression, it becomes the talk of around organizations. I think even in the small organizations, the one thing that we need to also normalize is having conversations around mental health, and normalizing that having mental issues is also part and and parcel of just being probably human. Those with lived experiences are also part of the society, and they deserve an opportunity, really. Uh, um, hmm. Ask Doc to comment about how do you help a person who's very productive but very loose morally, and do not even take time to think about the consequences of their actions until the reality of their actions come calling in. I don't know whether that is okay. Should
Now
I?
that one you have to pray for them because because now that's outside mental illness. Three things that people confuse: there's this fear of mental illness, there's this fear of criminality, and there's this fear of morality. Those two, they could intersect at some point, but at some point you are also dealing with different things. So if the question is morality, then that is not, it's not necessarily a mental illness. It could intersect, but it's different. Just the way you can have something that is morally wrong, but maybe it's not a crime in the law, and such things exist. So I may not want to comment. Maybe there are experts who can comment on it. Yeah, and the question is, for mental illness, the person has to be distressed at a personal level or distressing others. They may not be distressed. They may not know that anything is going wrong, but other people are getting distressed. So unless that is, and then their productivity, also the productivity is part of it, because distressing others is social dysfunction, and then low productivity is occupational function. Yeah, so if there is no dysfunction in the individual, there's nobody they're offending, they're destroying themselves, then there is, I don't know if there are some interventions that anyone can suggest, but it may have to be a pastor, really. I don't know.
Yeah, and maybe if it's something to do with mental illness, you think maybe you need to rephrase that question so that we can also understand from where you're coming from. Maybe give an example. But
And
Dr.
morality is
Chitai,
very wide. So again, it's
exactly.
cultural, and it's quite, it's quite complicated. We can't just prescribe things and say, oh, do this, or just say, well, some acts of indiscretion are due to a mental illness. That's for sure. Some, but not all.
Yeah. All right. And Edda has brought in an interesting question. So you've talked about psychology, you've talked about psychiatry. Where is the space for counseling?
Yeah, I like that question. So it depends on what problem you are solving. Yeah. So remember, I told you about some conditions that are not mental illnesses per se, but they are causing stress to the individual, like bereavement, for example. That is a candidate for counseling. Yeah. You're going through a loss, you should go through counseling. A student has failed the exam, they can go through counseling. Losing a job, etc. Even maybe being promoted, you should undergo counseling. It is, you're solving a single problem, and the goal of counseling is to help you find a solution to a problem, most likely a single one. The counseling is brief, 1 day to 1 week, that's done. I don't believe that counseling can go on for 1 year. Sometimes you find that kind of issues, but I don't believe that counseling should go on for 1 year. By its nature, it should be short. You are being helped to go through a problem, and that's it. Sometimes you get a patient, even in my case, maybe there's a patient who's already undergoing treatment, and then they undergo something else. So they can go through some brief counseling to help them navigate that difficult period. Yeah, they can undergo counseling in that period. Otherwise, in the clinical setting, you'll find that there are other therapies. For example, depression, necessarily we don't do counseling. If there are therapies that have been researched and found to work, like cognitive behavior therapy. So counseling, shorter, fewer days, and it's focusing on only one thing. It's mostly helping someone come up with a solution. They may even come up with the solution themselves when they are talking. They're just asking, what else do you think? You've gotten a D- in KCSE. What do you think you can do? And so on and so on. Finally, they could even come up with a solution themselves. Maybe at the start, they were thinking it's the end of the world, but we help them find a solution.
So is there a difference between psychology and and counseling? Because I hear them introducing themselves as counseling psychologists, and then there's also psychologists.
Yeah, okay. So in psychology, as we said, there are different branches. There are different branches of psychology. There is so a counseling psychologist, yeah, is a psychologist who mainly measures on the counseling, the shorter therapies. However, you also have counselors, and this way it gets confusing because you have people who go and do shorter courses, even a certificate, and become purely counselors. They're not psychologists, they're purely counselors. A good example is the guys who work in VCT. They're purely counselors. You may also have hospitals employing counselors to talk to patients who have found some diagnosis, maybe a cancer. After diagnosis, you undergo counseling to help you navigate that period. You are not mentally ill. You are just confused and angry and maybe in denial. So you talk to a counselor. So the training for that may be slightly lower than the training for a counseling psychologist who would have done a degree in a university. But again, the qualification for a counseling psychologist will be lower than a clinical psychologist because a clinical psychologist would have done a master's degree and specialized in clinical psychology, and they can be able to give more complex therapies. And so it goes like that. So it's because background training, what they do.
Now even I know.
It is part of the 10 differences. I also defined counselor. So I think that post, I don't know how we'll find it. I may not get it now, but it is somewhere online, the differences. And I've also talked about the counselors.
Okay, once I get it, I'll definitely post it on the Get It Right WhatsApp group for sure.
Right.
So we can also be able to even know who to seek help from. Grace
Yeah.
Kimeli, your hand is up as Dr. Chitai is preparing for his parting shot. Yes, Grace.
Thank you. Yeah, thank you. Thank you for the opportunity. I happen to be a counseling psychologist, and what Dr. Arya said is good. I just wanted to say psychiatrists prescribe or medicate, but counselors or psychologists is talk therapy. So that is the big difference. At least that is one we will never prescribe any medication, but the psychiatrist will always do that. Thank you.
Thank you,
Never
Grace.
say never. There are countries where the psychologists prescribe, although not in Kenya. But
yeah, no.
You see, one thing that I mean, one thing. This is very very intra-professional. So there are, for example, psychologists who are first clinical officers. So when they are clinical officers, they were prescribing. Then they did psychology. Should they prescribe or not? So there are some gray areas, but generally, what she has said, I agree that psychiatrists will generally prescribe when there's need. So we don't always prescribe. Again, another misconception is that if you come to see me, you live with a packet of drugs. No. You could come to me and I tell you the issue you have, you go and see a psychologist and do some counseling for 1 week. Yeah. I have found a reason why you are feeling this way. So it's not always medication.
Yeah, I think that's also something we need to demystify. Yes, I think that has been quite enlightening. And what is the link between emotional intelligence and mental health? That's the last question, Dr. Chitai, as you do your parting shot.
I don't know. I actually don't know, but I would guess that if you have high emotional intelligence, then you'll be someone who understands your emotions and those of others, and you are able to manage them very well. You can be able to, for example, if you are feeling angry, you can be able to tell why you are feeling angry, at least, or ask questions about why you are feeling angry. Maybe if you are about to act, you may have your own technique of breathing or counting from 50 to 1 to come down. So those are aspects of emotional intelligence, which interestingly, it can be increased, not like the IQ. Yeah, so emotional intelligence can be increased. So I will say, even without looking at any reference, that by its nature, high emotional intelligence will translate to good mental health.
I totally agree. And then we have the pillars of emotional intelligence. The self-awareness is also part of the solution to mental wellness. And then we have awareness of others, we have empathy and all those things. So they still lead to the same. And in emotional intelligence, we say what do we call it? Self-awareness is the gateway to emotional intelligence, but mindfulness is the gateway to what do we call it? Mindfulness is the gateway to self-awareness, and self-awareness is the gateway to emotional intelligence. But mindfulness is also one of the solutions to when you're having a what do we call it? Mental meltdown or something like that. Sometimes mindfulness helps you calm down. It helps you deal with all this anxiety and depression sometimes, all those things. So anyway, please, Jacinta has shared our WhatsApp group. You can be joining that, but give us your parting shot, Dr. Chitai, now that we lost Rosemary. This was going to be a very interesting conversation, but you have made it even really good. So we can have you separately another time. Yes, tell us.
Yeah, so mental health, everybody has their mental health. You may be at some point on the spectrum, but you may not know where you are. It's good to find out. It's one of those things you can walk into a professional's office, psychiatrist, psychologist, and find out your level of mental health. Mental illness, it's important to always know that anybody can suffer from mental illness. When it comes to work can improve our mental health because we get money from work, we get a status from work, yeah, and it helps us to manage time so that we are not idle. So in that regard, it is good for mental health. However, if a workplace, yeah, has many stressors or stressors that are unresolved, then it can contribute to poor mental health. There are many people who work has contributed to poor mental health. And when that happens, their productivity goes low. And therefore, we must put in place measures to manage issues at the workplace that can lead to mental illness and decreased productivity, both as a nation, but also as an organization. I stop there.
That's very true. So thank you so much, Dr. Chitai. This was quite enlightening. I don't know. I think I can see the claps and the love that is being passed and the ululation that is going on the chat, or rather on the reactions. So I think this has been quite impactful. Like every time I listen to a conversation on mental health, I normally just keep learning and learning and learning. So we can continue learning and unlearning. And thank you so much, Dr. Chitai, for creating time to be with us and even demystifying for us some of the simple things that we've just been getting wrong, so to speak. And we are over here to get it right. So thank you for helping us get it right in terms of supporting our workplaces and also our colleagues and our families as well. For sure. I think next time we are going to just discuss psychiatry so that we can we can learn more. I think we've been doing too much on psychology. I think we need to get to psychiatry and just really just dig deeper. Don't you agree? Mental health is real. Thanks you for putting this together. You are welcome. So please join us next Tuesday. We will be discussing leadership, transformational leadership. That's conversation we're having next Tuesday. However, at this point, please follow us on Instagram at Ara Solutions, like our Facebook page at Ara Solutions, connect with us on LinkedIn at Ara Solutions, and subscribe to our YouTube channel, Get It Right with Atara Solutions. At this point, I will just thank you, our audience, for being here. Catherine Sidandi, thank you for making us inclusive, our sign language interpreter. And of course, thank you to our speakers, Rosemary in absentia, and of course, Dr. Chitai. And if you're looking for referrals, do you still consult, Dr. Chitai? Or now you're just teaching?
Yes, I consult. My clinic is located at Riverside Drive, Dafton Court, Isia. Psychology consultants. That's why I consult. I have a clinic every Friday physically and any other day of the week virtually. So, and if you want to follow me on X, it's at Dr._Chitai. You can follow me. Sometimes I engage in mental health conversations and also on LinkedIn. Yeah.
Excellent, excellent. LinkedIn sounds like us, a lot of people on this call today. So we shall definitely connect with you. So thank you so much for making the time. And I personally really appreciate, and I am lucky to have friends like you who can demystify such issues in such a setup, easy like that. So thank you so much. And you guys, thank you so much. See you next Tuesday, same time, same place, as we cover another topic. Happy Mental Health Month. Please, if you've not had conversations around mental health this month, you have 2 days. Okay, wait, the month ends on Saturday. So you have a couple of days to do that. Please make sure you have those conversations and make sure that you invite people. By the way, hey, we need to have that conversation. This thing of you guys inviting non-practitioners to speak to your people. People who have not really been exposed to this. I had somebody lying to people the other day, but yeah, that's not a conversation for today. So thank you guys. Have yourselves a lovely, lovely night. See you next Tuesday. Good night.